Hello and welcome to an All Fliers group talk. I hope you're all feeling well and staying safe in this COVID-19 era. I'm a retired pharmacist and have been a private pilot. I've got a lifelong interest in aviation history. The health and well-being of aircrew has always been important. The early days of transcontinental flight when pilots with test limits are gone. The 33-hour transatlantic flight by Charles Lindbergh, for instance. Taking medication by pilots comes under the general heading of human factors. Drugs, legal or illegal, matter in aviation, just as they do for the general public who might be in charge of machinery. You would hope that your airline captain wasn't drug or alcohol affected, but what if he or she, because of jet lag, couldn't sleep and had taken a sleeping tablet, melatonin or valerian the night before? Would that matter? Pilots learn that before flying they ask themselves, am I okay to fly? They live by the mantra, 12 hours from the bottle to the throttle. Self-reporting covers not just whether they feel affected by a drug, but also covers their health and mental well-being too. Airlines will have their own operations manuals covering crew health precautions and medical regulations. This considers even dental work with a local anaesthetic. Piloting is stressful and being fully alert and confident is paramount. ICAO, the International Civil Aviation Organisation, a United Nations specialised agency, has a manual of civil aviation medicine, which, at 586 pages, shows the breadth of this subject. No area of human health is ignored. Each country in turn has its own jurisdiction. In Australia, it is the Civil Aviation Safety Authority. Their advice is that all medications are considered hazardous, and starting a medication or changing a dose up or down is a change of medical condition and must be reported to a designated aviation medical practitioner or to CASA within 5 days if lasting more than their stated amount of time. Changes of medical condition include commencing antibiotics. It may not be the antibiotic that is a concern, but the condition for which it is taken. Examples might include chest infections, coughing fits, urinary tract infections, eye infections, etc. Common approved drugs should not be taken for the first time before a flight, just in case it causes a reaction. CASA lists approved medications for use in minor ailments lasting less than a week and includes paracetamol, aspirin, non-sedating antihistamines and laxatives. I don't mind that my pilot has taken a paracetamol for a headache, but might be worried if the headache is a daily event. Ongoing use of contraceptive pill and topical ointments are approved. CASA lists medicines that must not be used without express clearance by the DAMI or CASA. And you might be surprised at inclusion of Roaccutane acne treatment, blood thinners, erection medications, sleeping tablets, and also 24-hour exclusion after vaccination. Then CASA lists medications that must not be used, and in fact you must be cleared of by a DAMI or CASA following cessation. Are any of these surprising to you? Sedating antihistamines, heart medications, codeine containing painkillers, oxycodone, tramadol painkillers, and a few others. Each country regulates its medicines into schedules. In Australia there are 8 schedules. For example, Schedule 4 is for prescription only and Schedule 8 is controlled drugs. A pilot travels between jurisdictions and could buy over-the-counter medication in one country that is banned in another. An international set of rules to apply to pilots makes sense. Now let us look at times when, at war, pilots were deliberately given drugs that affected performance. During World War II, amphetamines were used extensively by Allied and Axis forces for stimulant and performance-enhancing effect. Perhaps the taking of speed wasn't considered out of the ordinary. In 1934, SmithKline French marketed amphetamine as Benzedrine for nasal congestion. How times have changed. Surreptitiously, the giving of bromides to airmen to curtail libido has been shown to be untrue. Spike Milligan said, "I don't think that bromide had any lasting effect. The only way to stop a British soldier feeling randy is to load bromide into a 300-pound shell and fire it at him from the waist down. Did the giving of anti-malarial drugs to pilots serving in the tropics affect their performance? As quinine from the Dutch East Indies wasn't available, atabrine was substituted. Ironically, atabrine had been discovered by the Germans. The incidence of malaria at Milne Bay in Papua in 1942-1943 was rampant. Atabrine side effects included nightmares, anxiety, and rarely psychosis. Japanese propaganda said it caused infertility. I bet that troubled some pilots. Nowadays, the anti-malarial doxycycline or Malarone are considered safe for flight duties. The taking of vitamins in World War II, eating lots of carrots with its high concentration of vitamin A was said to improve night vision. This was British propaganda. Night pilot Cat's Eyes John Cunningham, using secret airborne radar, made his 19 night kills. It was let out that eating carrots was the secret to his success. Pilots might be exposed to chemicals such as when spraying herbicides or insecticides. Remember Agent Orange? This herbicide contained dioxin, highly toxic and linked to cancers, birth defects, diabetes and other disabilities. After the Vietnam War ended, Agent Orange was taken to Johnston Island in the Pacific and destroyed. Pilots, amateur or professional, have to be in tip-top form to fly themselves and their passengers safely to their destination. If ever in doubt as to fitness, fly another day. Thank you.